the end of repeal and replace, and what to expect in the future for accessible and affordable health care. The president blamed Democrats in Congress for the failure of the American Health Care Act. Now he predicts Obamacare will explode and or implode. Among South Florida's members of Congress, Ileana Ros-Lehtinen was the only Republican to join Democrats in early and unwavering opposition.
Well, he said, do not worry, because Obamacare is going to explode and we can blame the Democrats, and then we, the Republicans, will be the saviors. I don't care about blaming the Democrats. I don't want Republicans to look like saviors. I want the ones who are winning to be my constituents.
I knew crafting legislation to repair our healthcare system and ensure it operates more efficiently would not be easy, and we must take time to weigh all considerations. It remains critical that more be done to assist the most vulnerable in our communities.
And joining us this morning, Congresswoman Debbie Wasserman Schultz, Democrat of Weston.
Yes.
And back from Washington in a heck of a week. Good morning.
Boy, that's the understatement of the year.
Congresswoman, why did the Republican leadership and the president fail to pass the American Health Care Act?
Well, gosh, let me count the ways. When you are trying to take away health care from 24 million people, 14 million in the next year, when you are increasing health care costs by 15 to 20%, imposing an age tax, taking away funding for women's health care and reinstating pre-existing condition exclusions, that is not a recipe for comprehensive health care.
But they could not bring the factions of their own party. I mean, you have the Freedom Caucus, like to hear you expand on that, and then you had moderates in the House who said, no, you can't go that far. You're going to take health care away from my seniors.
Well, there's two, really, so let's separate this into two components. There's the very flawed process that they established to try to pass this bill, and the substance. So I just went through the substance. I mean, you had
for 1 minute.
Moderate Republican members who had, were in panic mode, that the constituents that they were hearing from were hearing all of the things that I just told you about that bill.
And overwhelmingly against the bill.
I mean, thousands of constituents calling our offices, and turning out at town hall meetings saying, don't take away my health care. And then there was the flawed process. If you remember, in 2010, when we passed the Affordable Care Act, there were 79 hearings of committees. There were hundreds of witnesses. We spent almost a year going through the legislative process to pass the Affordable Care Act. They jammed this bill through to the floor in less than 2 weeks with no hearings at all and 3 committee markups. That's it.
There was so much politicking going on that we've watched the past couple of weeks, but really, when you get down to it, to your point, it was really the constituency, the people, that killed the bill. I mean, respectfully, Democrats aside, that worked so hard to kill it, it really was about 24 Republicans responding to the call of the people to stop it.
Well, it was all of us responding to the call of the people. It was truly a grassroots movement. They really misfired when they spent 7 years believing that people don't care about comprehensive access to quality, affordable health care. What Tom Price, my former colleague, the Secretary of Health and Human Services, kept saying is, well, what we're going to guarantee is access. Access isn't coverage. And when you're sick, you need to make sure you can go to the doctor and get it taken care of.
So now that we're back to the Affordable Care, Obamacare, even supporters of Obamacare say it's not perfect. And there are a lot of people who are dead set against it. What is wrong with Obamacare as it stands that can be fixed? Well, what's the low-hanging fruit?
One of the main things, I'm not sure it's low-hanging fruit, but one of the main things that we have to solve is that there are about 1/3 of the counties in the country that only have one provider. It doesn't mean that they only have one plan. Those providers offer a variety of plans, but when you don't have the kind of competition in a community that you need, as a result, the prices are a little bit higher. But that's a solvable problem, as are a number of other things, including some of the ways that we're funding the subsidies. And I mean, what we need to do, and what we've always needed to do, is to just sit down together at a table and hammer out the differences of opinion and resolve the problems and focus on fixing this law.
On Friday afternoon at the White House, the president first said the Democrats are to blame. This didn't pass because of the Democrats. But later on in that extraordinary session, he said, well, we really do have to get together, the Democrats. They'll eventually come to us, and then we'll sit down and talk together. Is that a good strategy?
Well, first of all, if he wants to blame us, we are happy to shoulder the burden of denying them the ability to take away health care from millions of people. But they did this to themselves. I mean, they are at war with one another and have been for a long time. They messed up on how they tried to pass this bill, and they were draconian and horrendous. It was an abhorrent piece of legislation. So the blame lies with Donald Trump, who clearly didn't engage at all and knew nothing about the contents of the bill, his very inexperienced team at the White House who had no idea how to work the legislative process.
And how badly wounded is the president now, because he's had the courts reverse him on the travel ban. He's lost here on the first major piece of legislation. He says, yeah, let's go on now to tax reform. Can he go on to tax reform?
This is a president who has had not only no successes so far, but has shown how it's amateur hour at the White House.
Well, he's had, may I just say, some successes. I mean, the markets have gone up prior to this week. There's some regulations that some people would point to some successes. I just wanted to throw the other side of the story.
He does not get credit for those successes. The market has been going up astronomically.
He took the credit.
He'll take the credit. That doesn't mean he deserves the credit. But he's had not one legislative success, not one achievement that can be attributed to him. And you have a cloud, an entire storm hanging over the White House with the clear indication from intelligence reports and the investigation that's going on that there was possibly collusion between the Trump campaign and the Russians.
Before we get off health care, I do want to show people in our audience the photograph from the White House, I believe, Friday afternoon. This was the president with a large group of older white men, and who doesn't love them? I certainly do.
We all do.
Yes, I mean, we all have an older white man in our life.
The serious point I would like you to comment on is here is a group of white men who are making decisions about women's health, as among others, but there's not a woman in the room.
If you take out the color from that photo, you know, you would think that it was a photo from the 1950s, not the 2007.
I can see Sam Rayburn.
And those are people who are making decisions about women's access to health care. If that doesn't say out of touch, then scream out of touch. I don't know what does.
Well, that's the Freedom Caucus in that room, and I would question why.
It's also the Republican Party, because they have very few women.
Well, why aren't there women in the Freedom Caucus would be my biggest question. One last question.
The Freedom Caucus is extreme, and most of the women in the Republican Party are not.
Last question. The president tweeted yesterday morning, Obamacare will explode, don't worry, which I guess is worrisome on some level, even if it happens, but will implode, my bad.
No, he said explode.
Will it, he said explode, he said implode. Yeah. The question is, will it? And that is worrisome if it does.
The only way that Obamacare explodes or implodes is if the Republicans add a detonator and light the fuse. And that's the concern that I have now, is that they will intentionally undermine it and try to destroy it from within. What we need to do is, and I hope the president and the Republicans in Congress realize this and actually take that action, sit down with Democrats who have always been willing to work on the problems that we have with the Affordable Care Act and improve it. But the Affordable Care Act is working. That's why millions of people from around the country protested and said, don't take away my health care. It's made my life better. We have a health care system, not a sick care system, and we can't go backward.
Congresswoman, great to have you come in.
Always great
have
to
a great rest of your Sunday with your family.
Thank you.
When we